Work in progress. You heard the expression, if life gives you lemons, make lemonade. What if something happens to you medically? Do you give up or do you push on? Work in progress. Life is a journey. It's a work in progress. All right, looks like a standard walker. Pretty much is. However, we added some sports tape and built up her handle here on the right side. So my wonderful patient, dear friend, she had a stroke on her right side. So she has weakness on her right leg and her right arm. So this helps prevent her hand from sliding forward off of the walker. When I first met her, she was able to walk maybe 3 to 5 feet. And she did that. It totally exhausted her. Today, she walked all the way from her room to the dining hall, which is about 150 feet. And she was beyond happy. So today is a day of celebration for her. I'm very proud of you. What causes a stroke? Stroke, due to lack of blood flow to a certain part of the brain, it can result in injury to a certain portion of the brain. Typically, it usually affects either the left side or the right side. If the injury occurs on one side, as example, the left side of the brain, then it'll affect, resulting in muscle weakness on the other side of the body. There's other types of symptoms of a stroke, but typically what you see is weakness to one side of the body. My friend, my patient, her stroke occurred on the left side of the brain and affected the right side of her body. Started working with my friend, my patient, probably about 8 months ago. At that point in time, she was able to walk about 3 to 5 feet, very exhausting, off balance, had to use a gait belt to help stabilize her. Today, on 4 separate bouts, she walked from her room down to the dining hall. It's about 150 feet. Took her about 35 to 40 minutes to do it. But when she arrived in the dining hall, there was a number of the caregivers as well as fellow residents applauding her as she was able to walk for the first time from her room all the way to the dining table. This is something she wanted to share with me today to commemorate this special event. My friend, she is right-handed. However, the stroke affected her right side. She was a painter, an artist, and loved to share her artwork with friends and family. She hasn't painted or drawn much over the past 4 to 5 years due to her weakness in her right arm. This rose, done in watercolor, she did it completely with her left hand. Thank you, my friend, for sharing such a wonderful gift. I will buy a frame and keep this in a very special place in our home.